Huples Cat Productions. We're going to do this weekend a series of videos on personal protective equipment for people at home. This of course could be and should be adapted to healthcare work, whether you're a paramedic or a grocery store worker or a doctor. If your facility runs out of actually effective PPE and you're forced to use no PPE or you're forced to use inadequate PPE. Treating COVID-19 or suspected COVID-19 patients. So the main thing about PPE is to actually put it on in the right order, and that is what people focus on, and people don't generally have too much difficulty with that. But I have in 2003 gone into a SARS room without an N95 underneath the actual HEPA hood suit because I forgot, and my spotter was also tied and we forgot. So for that reason I recommend you actually have on a big piece of paper or written directly onto the wall, where you exit the house or come into the house, a checklist for putting it on and putting it off. Now the checklist of taking it off, which is called doffing, you probably should have outside the house. If you're actually going to go through the bother of wearing specific gear to go out and about in the community, which in this case will be when you are allowed to and you've registered online very soon in North America to go grocery shopping or to the doctors or to the pharmacists, things are going to get very, very limited in what you can actually do. So the big question is, how many N95s do you need? Well, if you're a healthcare worker, you need as many of these as you can get. And if you're a member of the public, probably 10 to 20 of these per adult is overkill, because you're not going to throw these out. Until we get manufacturers to make a pile of these, like I'm talking in the millions per week zone, we're not really ever going to have too many of these. We're always going to have an absolute shortage. So for me, one of the failures of capitalism has always been convenience. Like single use, it's safe because it's single, use it, throw it out. Mysteriously disappears the plastic bits, the foam bits, the toxic metals in the water stream by millions, tens of millions, hundreds of millions of single-use products. Doesn't really bother anybody because we don't directly see it. But what we do is we drink it in and we eat it and we actually breathe it. And over time that will kill us. It will kill large numbers of the carnivores on the planet and the higher level food animals because we eat the rest of them. So this sort of toxicity is going to be generated up. So for that reason alone, reusable PPE would be smart. But I know people aren't really thinking about climate change or the planet right now. Nor am I particularly. I'm doing my best though. So now I'm going to put on hospital PPE Overkill version, and it will be sped up, and I'll tell you at the end about what I was doing and why.
Like a bird on a tree, I'm just sitting here. I got time, it's clear to see. From up here, the world seems small. We can sit together. It's so beautiful, you and me, we meant to be.
So a couple of things. I'd like to have longer gloves, and they're recommended. You don't need to tape these in unless there's a risk of it rolling down and you're getting contaminated here. You might miss washing it afterwards. I want swim goggles. I have swim goggles. I'll put them on. I'm not putting them on because I'm conserving what I have. Things break with repeated use, and that's why I've been very careful what I use. All of this stuff is discarded equipment from a couple of years ago because I actually put this stuff on to actually go into the operating room when they have a code red, which is a fire or etc. So, and then we just throw it in the garbage. So when I've gone in the corridor and I've talked to the fire service personnel, I've kept a few of these over the years because, to be honest with you, they're absolutely completely clean, and the only purpose I put them on was for me and my clothes not to contaminate the operating room, not to be in an infected area. It's different when you're in an infected area because it's all single use, and even a very lightweight outfit like this is going to be very hot in use. But a couple of things: if you're going to be using diarrhea, if you're going to be using blood, if you're going to be really, really messy with the patient, I would consider sealing these off. This is not going to stop fluids getting in, but there's no reason why you can't use double gloves. The only reason not to use double gloves is you lose a little bit of tactile ability, and if you're drawing blood from a vein or an artery, that's kind of difficult. But you might want to consider this sort of thing, and you might want to consider how much of this stuff your employer has, right? Like literally you're going to generate garbage bags of stuff, and you're going to be a lot safer than not having any PPE, but there's still a risk. You can still break contamination. So face shields are also recommended. Now a lot of the face shields have a foam rubber band on it. Now as of the moment, in the end of March 2020, we're not recommending the ones with the foam. Although they're much more comfortable, they actually may have problems in terms of infecting the people. So we're using solid plastic. You pays your choice, you use what you get. I have a couple of old shields. I'm not using them. I'm really keeping them. They're very fragile, to be honest, the ones we have, because they're single use, but I'm keeping them for extremists. Now what's recommended for airborne is a gown, a level 4 gown. Obviously we don't have anywhere near enough of these. These are the operating room gowns. These are again single use. These are available in cotton. They're actually sterile inside the packets. There's also a sterile area to put down, so you can really make sure that things are good and wash your hands with a sterile gown. And technically you would need 2 people to help you put this on. But what you ever do with all of the sterile stuff is you actually keep it and do not actually try to touch, okay, the outside at all. But sterile to sterile is actually fine. This is single use. This is why healthcare costs so much money. Absolutely crazy. A couple of people get infected from reusable stuff because sterile procedures and cleaning wasn't done right. Now if you're sterile, you wouldn't do this. You need somebody else to do it for you. But this is actually what you would want to wear with sealed goggles and a face shield in a COVID-19 room. This is roughly what the World Health Organization recommends for airborne infections. This is what we need. This is what we mostly do not have. Now what we're doing now is we're in conservation of this. So if you have this sort of stuff, they are telling you to keep this on for the entire shift between patients. In other words, the risk of me cross-contaminating infections between the patients, because it might be COVID-19 but they might also have MRSA, no, we don't care. Our protection is the most important thing, so we're going to conserve by reusing. This would be extremely uncomfortable. In SARS in 2003, what we did was we wore sports gear, sports t-shirts, sports shorts, lightweight gear. So even normal clothing like I have on now rapidly traps the air, which is what you want. You don't want the air coming in with the viruses get really hot. Bear that in mind. So how do you take this stuff off? One of the things I tend to do that's not recommended is this. Now this is now contaminated, right? The top of that's contaminated. But I'll do this for the 20 seconds before I start getting into it, because I know I'm going to be touching around and I'm not really keen on that. So taking stuff off has to be done in a very specific order. Now I have boots on and booties, which I generally wouldn't have, but if you do have them on, they come off first. And a lot of times what you take them off is this way. So the first boot, you can take it off like this. Quite simply, hold it down with the other one, dirty to dirty, and now this is clean. Now you should hopefully have a system where you can step back into a clean area and move that forward. Now I want to get rid of the second boot. Got my clean gloves on. Inside is clean, outside. So inside I'm touching, I'm not touching the outside into the disposable area. Now I don't want to touch my face at all. So I want to take the gown off. Could be a yellow gown, could be a trash bag, could be a paper gown, could be a gown like this, could be a cotton gown. Once it's open, you don't really want to touch the inside with your hands because they could be contaminated, so I tend to do this. Taking it gently. Remember, any sudden movements is going to generate possible virus from the outside of this into the air. So I'm going to do this sort of thing. For single use, this is what I'm going to do. Gentle, gentle, into the bin. Now at this point, if I've got 2 gloves on, the top layer of gloves comes off. Okay? And again, if you're going to throw them out, you can do this and then into the garbage. But if you're going to keep them, no, sorry, that was wrong. So this is now cleaner than this, because this is the inner layer, they're the outer layer. So you want to catch the edge of this. Now if you take these in, somebody's going to have to cut you out, right? It's the only safe way of doing it. So when you pull it out, if you're going to reuse them, do it gently. And then into the bleach solution. So at this point, what am I going to do? At this point, I'm taking the gloves off. And I'm washing my hands. Remember, this was previously possibly contaminated. So I really want to give it a good go. And at this point, with a known COVID case, I'm going to do this sort of thing as well. And then I'm going to do another 20 seconds, really deeply, okay? Try to avoid touching the paper gown. This is just the first level of protection as I take off the rest of the stuff. So 20 seconds go by, taking this off. Don't really want to touch it too much. The inside's okay. Fully open it. If there's any Velcro cut, pull before you take it off. When you take it off, take your time. Really take your time. Remember, you're going to be very tired, and if it's a bit tight, you might want somebody to help you. Now what I'm recommending is a mirror. If you don't have a mirror, have somebody to look at you. But for most of us, a mirror like this should be available. Once it's available, what you need to do is actually have this set up where you're going to take the stuff off. Once you get the first arm out, it's pretty easy. Again, gently roll it down. Don't do it too viciously. Get this off, throw it in the garbage, sealed garbage, or bleach solution. And then wash your hands. There's ways of setting this up so you don't have to wash your hands as much. I think for most people, what I'm going to recommend is if you have adequate hand sanitizer, or you're able to use soap and water, and you know you've been in a really contaminated area, and you know that you don't have it, I'd probably wash my hands every single stage here in case I've contaminated. I don't want to cross-contaminate. Like if I've been taking this off and I've got virus on here and I don't know about it, and I touch this and I touch this, it's bad. So then what generally we do, you notice the mask is on top of this. So what I'm going to generally do is take off the face shield or the goggles and dispose of them. When I take this off, I'm taking off the strap that's actually down here first. Okay? So this is slightly different. This is actually the way you're supposed to take them off. Right? So a lot of things are told to do it a certain way because of other equipment. So then when I take this off, don't breathe, don't talk, into the garbage, into your recycler system, whatever it is. The hat then comes off gently. Sorry, they're now recommending we take the hats off like this. Now you can, if you've got the straps of the mask on underneath, of course you would leave the mask on last. So I'd probably actually do it in a different way. What I'd probably do in reality, if I'm getting ready, is I'd probably put this on first. Then when I put this on, the clean one, have it on, when I take it off, I'm going to take the face shield off, the goggles off, hopefully at both, and then I'm going to slowly take this off from behind, which is really difficult, but so you need to practice this, and then I will take off the mask the way I normally take it off. So as with all stuff like this, follow your employer's recommended protocols. In the time of COVID, if you can spare the equipment or improvise the equipment, practice putting this stuff on and taking it off. What killed people in SARS who worked in healthcare in Toronto was reusing equipment. What's going to kill people in COVID-19 who work in healthcare is lack of equipment as well as reusing it. Airborne requires an N95. It doesn't make you safe. Now all of this stuff is designed specifically for you to be in a very small room for a prolonged period of time with somebody who's actually got COVID-19 and are generating aerosol. They are coughing severely or you have pressured air into their lungs. This is not designed for people to go to their local Walmart to get some grocery supplies. It's utterly unnecessary. There is a lot of people saying, well, more equipment's better than less. in those sorts of normal circumstances. And of course it is, but it isn't, because this stuff has a finite supply. Even the reusable stuff will break over several weeks to months of use, and I'm thinking we're using this for 2 to 3 months, possibly longer. So you'd want to be harbouring the stuff that you have now with a viewpoint, this might have to do me the next 6 months without resupply. And I think that's the way to look at pretty much everything we have, including food and hand sanitizer and dog treats and dog food. It's going to be very difficult for us to make the adjustment to limited and no supply when we're used to the time of infinite variety and no waste. It's going to be a very challenging time for everybody, including healthcare workers. So currently at the end of March, what my employer is recommending is kind of at odds with what the World Health Organization recommends. They're recommending surgical masks which do almost nothing to protect the wearer from getting an airborne infection, but are fairly good at stopping other people catching it if you're infected whilst you're wearing it. So I'm not really thrilled about that. What they're doing is they're limiting 2 masks per person per shift in COVID probable areas, and 1 mask to people who are working in payroll and stuff like that who are interfacing with COVID workers. So that brings up the whole sticky question of why we don't actually have surgical masks being promoted in the general population. And that's a topic of another video entirely, but it's largely because of lack of supply. The fallacy is that if you have surgical masks, they should all be given to healthcare workers. Really, no. Most healthcare workers do require N95s, so we need them, but the grocery workers, the Amazon delivery people, the people who are essential, like post office, cigar salesmen and liquor store people, all those people who are interfacing with the public, pet store owners, they're the ones that actually really need to wear the surgical mask. The reason being that if they're infected, they might see 200, 500, 1,000 people per day. And if we're serious about stopping this, we needed to contain it in China. We didn't. If we needed to stop it, we had to contain it when it arrived on our borders, over our borders by plane and boat. We didn't. So what we have to do now is we have to live with this virus and hopefully we can contain it spread by draconian measures to stop it becoming endemic, which means it's always there in our society. And the reason for this is because it has a kill rate and an infection rate like nothing we've seen in the last 100 years, and it will kill a lot of people, and unfortunately it won't just kill the elderly. If you're a 25-year-old healthcare nurse, you probably have got very low limited chances of actually dying from COVID-19 compared to a 55-year-old healthcare worker nurse, especially one who's male and a bit chunky. Yeah guys, it's not just obese, it's any extra weight and being male and being older that really is the death thing from this. So this may have been designed by a woman, I don't know, it wasn't designed. But it doesn't matter, the 25-year-old female athletic nurse without any healthcare issues, who takes all the precautions, who accidentally gets coughed on 20 minutes before she goes to the coffee lineup, because it's still in the air for 30 minutes or more, or is on the surface of the counter that she's leaning on because she's tired on the shift, she can still catch this, she can easily catch it, she can still get very ill from this, and she can still get ventilated and die from it. You're not immune by age. Now they keep claiming that children are immune. Now they think this is due to the cytokine storm and the immature immunity system in children and babies, but they're guessing, they do not know. It sounds probable, and you're probably going to hear a lot about cytokine storms and stuff like that. Frankly, if you get into that, you're dead, so don't worry about it too much. Avoid getting COVID-19 disease, that's the thing, avoid it. And if you get it, rest up, hydrate, be sensible, try not to pass it on to other people. And just because you don't think you have it, or you think that you're superhuman and can't get it, those are the people that are going to be, due to denial, going to spread it widely. And everybody's saying that, you know, the cure is worse than the disease. It isn't. It really isn't. It's not anything. We can pay any price here other than lives to save lives. And this isn't saving a few thousand, a few 100,000 people a year who are mostly decrepit and old. Children still die every year from, you know, flu. Now, a lot of those children actually have underlying physical and mental health conditions. You know, we're saving more and more people with modern healthcare, and that's what society wants us to do at enormous physical and mental and in financial cost. But every so often nature comes along and goes, hey, which is the weakest, and takes them out. The difference here is nature isn't saying, hey, who's the weakest, let's take them out. They're saying, hey, let's try and take everybody out. Obviously the weakest are going to get killed first, or more easy to be killed, but everyone here is a target. No one has immunity. So that's it for this video. Remember, in SHTF, tomorrow will always be worse than today, and in a pandemic, tomorrow will always be worse than today until it goes away, and it will go away and things will get better. So make sure you look after yourself at work and make sure you do things correctly. Tomorrow's video is improvised PPE, and again, I don't recommend it. I can't because of legal, and I don't recommend it for use at work because of legal. But if you have inadequate PPE, if you have no PPE and you work as an ambulance driver or a porter in a hospital, seriously consider how you can more protect yourself and how you can tell your co-workers to do it in a condition of a full-on surge pandemic, because you need to. And if your employers keep kicking up a fuss about it, just tell them, just show them Google, show them the World Health Organization's recommendations and say, you failed to provide this, you're financially liable, what I'm doing here is safer. Toodles. This has been a 2020 Bad Bull Terry production.